So for me, this is a job half finished. This is a book half read. And so I really want to be involved. This is my community. And I really want to ensure as much as I can as one person, the safety and well-being of every community member. To be able to do that also at the state level so that I can really have impact across the entire state. That's why I do it.
What has the last month been like for you?
Yeah, Mark, definitely it's interesting would be probably the the best adjective to use. It's just, a lot of ups and downs. It just, there have been some highs and some lows. Certainly, as I mentioned earlier, Mark, the amount of support that Amy and I have received has just really helped us immeasurably during the last few weeks.
What do you think about the current situation with COVID-19 in Washington and in particular in Eastern Washington?
It's disturbing. It's concerning. Certainly in Spokane, as you know, if you look at the curve, you've never really seen a decrease of significance. Gosh, we had a little bit of a downturn during the summer, but for the most part, we've just been on this sort of gradual rise. And then, after September, it just sort of exponentially blew up, and we continue to see a real significant increase. Spokane, but also Eastern Washington.
But do you feel like Spokane Regional Health at the moment is handling the situation good or poorly, or could they do better? What are your thoughts on that?
No, I think, irrespective of me not being there, Mark, the professionals at SRHD, they always will be doing their best work to ensure the safety and the health of the entire community. So irrespective of my absence, I mean, they're doing everything they can, but it's not just the agency, it's not just the public health professionals, it's everyone collectively that needs to be really working because, what they're doing is providing the guidance, providing the epidemiological investigations and recommendations, but it really comes down to what people are doing.
And again, Dr. Lutz declined to discuss his departure from Spokane Regional Health. In terms of his new role, he says he'll be focused squarely on the state's response to the pandemic. He says he'll be working remotely and that he and his wife are staying in Spokane.